Welcome to DPC Pediatrician. We're Dr. Phil Boucher
and Dr. Marina Capella, two DPC pediatricians who are on a mission to share our love of direct primary care with you.
Welcome everyone to another episode of the DPC Pediatricians podcast. Today, Phil and I are going to be talking about attrition in pediatric DPC. It's one of the questions that kind of circulates around in the DPC atmosphere of, okay, I work so hard to get these patients to attract them to my practice. And then there's always a risk of people leaving. And when they leave, why do they leave? And how common is it for people to leave your practice after they sign up for this membership model and experience the great quality and the great accessibility and everything that DPC offers? So Phil and I have been in DPC practice now for about 5 years. Phil, when you think about the patients who have left your membership, what are the top reasons that you can think of for why that happens?
Yeah, so it's interesting that this topic, I was looking at the topic list today, and just this morning a mom had texted and said, is it possible for us to rejoin? And I was looking back at when did they leave? And it was 2 months ago. And
oh, wow.
So that felt good that sometimes people leave for whatever reason, and then they realize the grass wasn't greener on the other side, or the reasons that they left, actually, we did solve a problem for them. So I think in the big picture, when I think about attrition in general, I think that it's mostly either at the end of the day, if you're doing a good job providing good care and living up to what you've said in terms of your availability and access and all the things that you've kind of stated, these are the important mission and values and the way that we practice. The reason that people usually leave is financial. They either their job changes, their health insurance gets better or gets worse or costs them more, and they don't necessarily see or experience the value of what it is like to go back to a fee-for-service practice because they don't remember or haven't experienced the way it works in a fee-for-service practice. And they're like, well, we have better insurance now, or our insurance premiums went up so much, we just have to make this switch. So usually I can't think of anybody, and I'm not trying to brag, I can't think of anybody that's left that was like, you guys did not live up to what you say, or you weren't available enough, or your boundaries suck, or things along those lines. There's usually a legitimate reason from the financial reason that they're deciding to leave.
Yeah, absolutely. I would echo that. In my experience, the people who have left, by and large, it has been because of the financial piece. And it's not always that they can't afford it. It is often as well that they can't afford it. So sometimes families are experiencing more financial hardship, or a parent lost a job, or especially one family recently, they had their second child, and mom decided trying to take care of two children and breastfeeding and doing all the things at work is just too much. So I'm going to take a break from working. I'm going to stay home for a while. And so all of a sudden their family income saw a big drop, right? And they had to make some hard choices about, okay, this is how much we have in the pot of money each month. Where are we going to allocate that, right? And everybody has to make those hard decisions for themselves. Every household has to ask those questions. And so when it comes to, okay, paying $200 a month for the two kids or whatever, often we are on the chopping block when those hard decisions have to be made, right? Because it's not a necessity necessarily, it's a luxury for many families. And we have to understand that as DPC doctors, right? If the family has insurance or has another way of getting medical care, even if it's not nearly as great as what we offer, sometimes families are going to make that decision to go back to what is at least something, even if it's not as good as they wanted, right? So that family left, of course, because of financial reasons. But I've also had an experience similar to what you just said of a family leaving and then wanting to come back because they went and they were reminded of the realities of the medical world, the insurance-based medical world, and said, oh, okay, maybe actually it is worth that extra financial stretch to do that.
we ask like, okay, of course we can transfer your records. Can you give us a little bit more information on what's going on or what's changed, just so we can get a flavor for why are they leaving? Are they not using it? Are my jokes not funny enough?
Mm-hmm.
Is our hours not what they're looking for? And it typically just comes down to finances, which I completely understand. Like, most people have a budget. Most people have to make these choices. And as we've discussed on previous episodes, it's not simply their finances that drives people to DPC, because we have a lot of people in our community that are quite well off that have no interest in DPC and would never even
Yeah.
consider it. And on the flip side, we have a lot that are really scraping to get by, but see the value of it. And so I think most of it comes down to, outside of just regular old, like we have to trim things from the budget, it's often a value perception. Is this worth it? And if I haven't had to show my insurance card or get bills from my kid's pediatrician 3 months later for a stuffy nose that turned into an ear infection, that had to have an ear infection recheck, and that was 3 copays and then 3 coinsurances, and you're telling me I'm out $900 now, or I owe $900 for those sick visits that went to my deductible, that calculus can change back once they realize, oh yeah, this is how fee for service healthcare actually works. What do you
Mm-hmm.
think in terms of things, Marina, that help to reduce attrition? If we're talking about attrition being a standard part of business, what are the strategies that you found or that you implement to try and reduce attrition?
Mm-hmm. Yeah. I think that touch points along the way, especially for those families who don't need you very often, are
Mhm,
important. Recently,
totally.
we had an episode on newsletters, and that was one of the goals behind my newsletter is to really, okay, some of the families, like they pay my membership fee and they only reach out to me like once or twice a year. So it's almost this guilt that I feel charging them what I'm charging them for
Right,
that like single visit per year. And so I thought, well, a newsletter is really easy to do once it's kind of once we have that system in place,
right.
and it acts as a touch point so that the family is getting something, quote unquote, even when they're not seeing me in person, right? And it's also a reminder to them that, hey, I'm here for you if you need anything, right? Sometimes families just have it on auto charge. I know I have things on my credit card auto pay that I forget
Totally.
I have, right?
Totally.
Because I signed up a long time ago and it's like, oh, I forgot I signed up for that thing, right? So the newsletter acts as that kind of reminder of like, okay, Dr. Capella's here if I ever need
Right.
anything, or here's some free information, or here's something about a local event going on that I can take my kids to, and things like that. So I think
Mhm.
that acts as a nice little reminder, first, that I'm here, but also as offering a little bit of something to them, even when they're not needing to see me in the office very often.
Yeah, I think in the family practice realm, it's very different because the costs are much lower and people don't want to need their doctor. And we want regular touch points and all those sorts of things. So it
Yeah.
presents us with the challenge of like getting in front of our patients, especially those that have school aged kids who are not
Yeah.
going to see on a regular basis. They're not texting with the stuffy noses and the rashes and the poop pictures and all those sorts of things.
Yeah.
We're just seeing them on a less regular basis. So we want to proactively remind them, hey, we're here for you and we can help. And here's the things that we offer. Whereas I think some, if the fees were less, you might just try and stay under the radar so that they forget that you're paying
Yeah.
them on a regular basis.
Uh-huh.
In pediatrics, and especially at the higher price point for direct pediatric care, I think it's worthwhile to proactively show, hey, we see you, you're here, we're standing by and ready to help you when you need it. And I think newsletters are a great
Hmm.
way to do that. I had
Yeah.
a birthday recently, and
Uh-huh.
I actually absolutely hate getting the automated birthday remind or like emails from, like, I got one from my primary care doctor from like 12 years ago when I lived in a different city. That was like, happy birthday.
Hmm.
I'm like,
Yeah. When it's an automated like text or an automated email, it feels so depersonalized that it doesn't really matter. I actually pay
totally
my virtual assistant to send handwritten cards. I used to do it
love it.
myself for the first couple of
Yeah,
years when I had a smaller panel, and then things just got busier, so I offloaded it, and it has this little like wax seal stamp with the bunny on
oh
it, and
yeah,
it's handwritten, so it's a little bit of a personalized touch for my members. So little things like that you can
I
do
think
ways to
that
do.
That is such a different experience than just like the auto-generated, like
Yeah.
misspelled name, happy birthday,
Yeah.
Philip with 2 L's sort of emails that you get. And you're like, dude, that just
Uh-huh.
wasted that tiny amount of electricity. And now I have to waste my
Yeah.
time, like grumbling as I clean out my inbox and those sorts of things. But I love that idea. And I think the in between of those could be something like you take a picture that's in like a birthday hat or something like that. And I mean, you don't have to do it for every kid if you don't want to. You could do this every year and just update it to make sure that you don't
Mhm.
send the same picture to the same kid twice.
Yeah.
But just have like a happy birthday and then happy birthday, Leo. Somebody in your staff sends those out or schedule. I mean, you could schedule that in an afternoon. You could just schedule that out for the
Mhm.
whole year for the majority of the kids in the practice to just have
That's
an
true.
automated text message go out
Yeah.
that says, hey, happy birthday. And that's so personalized and so
Mhm.
different because they see you and they see your face and they get to show their kid like, oh, look, Dr. B sent you a happy birthday message. Um,
Uh-huh.
that actually sparks in me that is something that would be good to do. Um,
Uh-huh.
one way that we found for our older kids, because attrition for 1-year-olds, 2-year-olds is quite low
Mhm.
compared to the 14-year-olds that really we see for their checkup, we see for their sore throat, maybe a mental health visit here or there. One thing that we do to try and say, okay, like we're still relevant and we want to make sure that we're there for you is we do a quarterly PHQ-9 and GAD-7 mental health screening. So
Mm.
people are used to, especially if they're kids, if they were at a fee-for-service practice, the annual checkup in the summer where they do the mental health screening and then we don't hear from you for a whole year. And a lot of things can happen mental health wise, obviously, during all that span. So what we say is like we want to keep closer tabs. If there's nothing going on, great, but it's hard for parents to know often. And I mean, I'm sure you had this experience many a time. You go in for the quick summer checkup and they're scoring super high on their GAD-7 or their
Mhm.
PHQ-9 and like the whole
Yeah.
conversation shifts. What instead we do is we just send that out and it's automated, super easy. If they flag high, then we'll reach out to them. Otherwise, we just say
Mhm.
like, if you don't hear from us, keep going and we'll send you another one in another quarter. Not everybody does
Yeah.
it, but everybody knows that like that's something that we're keeping a close eye on and it takes almost
Yeah.
no work on us, but it shows our value and that we care.
Mhm. Yeah, that's nice. I mean, you do have to have some sort of automation tool in order to do that. How do you do that? Is it through your EMR?
Um, so actually we just use Spruce and we have a standard like form link and we
Yeah.
just schedule the text message that says, hey, it's time for your kids quarterly mental health screening. Hand the phone to them. They'll click this link. They put their name in. They fill out the GAD-7 and the PHQ-9. It pops back to
Mhm.
us in their chart, and then we can look at those from there. So it's pretty simple and easy to manage with about any EMR or something along those lines.
Gotcha. Yeah, interesting. Yeah, I think that's a great idea, especially since those teens, it's often a hard sell. DPC is a hard sell for the parents of teenagers who really,
Totally.
at least per the parents, they say, oh, they just need their once a year physical.
Yep.
Most of the time, when they actually join, they need more than that because those
Mhm.
teenage years can be tumultuous. And
Yep.
that's when anxiety and depression start to arise. And that's when just other issues can pop up, sports injuries, concussions, all sorts of stuff. And
Totally.
so they do often utilize more than they think they will, right?
Right.
Yeah. Another thing is I have families sometimes who really can afford what I offer, but it's we talked about how there are families who are kind of living paycheck to paycheck, but they really see the value. And then on the other end of the spectrum, there are families who really do have plenty of money to pay, but it's that psychological understanding of the value, right? Recently had
Yeah.
a mom reach out wanting to join. I know this family has plenty of money. They have multiple homes, they have multiple businesses, they own a ton of real estate. They're doing just fine. But it took a lot of messaging back and forth for her to finally decide after a few weeks of messaging back and forth. And ultimately, I just had to say, look, you're paying for my accessibility, right?
Right.
It's like when you give a lawyer a retainer, right? You're paying for that accessibility to them
Right.
and that work going forward because you never know exactly what's going to happen. And also just my time. Another doctor's not going to answer you at 8 p.m. for
Right.
something urgent. I do that. And in
Totally.
order to be able to do that, I have to limit my panel and I have to charge what I charge, right? And so, but even then, there will be families that just, they feel like they haven't used it in a while. They feel like they don't need it. Another reason for attrition we should mention is families just moving away, right?
Sure.
I have had many families. I would say the majority of my attrition that I've had is related to families moving away. They're moving to a
Yep.
different state. Some of them moving international, some of them just moving maybe an hour away, but it's too far of a drive for them
Sure.
to think that it's worth it, right? How about you? Do you have much movement in your practice due to people just moving?
Yeah, we do. I mean, those are the ones that usually they like are really sad to break up because then
Yeah.
they're like moving away and have to find another doctor. And we always just try and like proactively help them. Like, what's your new zip code? Okay, let me
Yeah.
plug it into the mapper and see who's nearby and get you
Yeah.
set up with a new practice. Because once people
Mhm.
are used to DPC, they really don't want to go back to fee for service. And so we just try and plug them in there. But I think that's a major reason for attrition too. If you're taking good care of people, if you're holding up to your promises in terms of access and availability and those sorts of things, then the financial and the moving are going to be the vast majority of why people are leaving your practice. And I think that
Mhm.
it is always surprising to me how people value that, but in terms of the value perception, because we've had families that are on Medicaid that are living paycheck to paycheck, and I go through the meet and greet with them, and I'm like, as a reminder, we don't take insurance. And then they'll be like, that's all that it costs. Because they can do the math on missing
Mhm.
a day of work versus being able to text and say, hey, does this need to come in? Or what's the deal with this rash? Do I have to take off half a day of work to have you look at my child's eczema? Or can you do it over text message? Like they can do the math.
Yeah.
And realize that there's the value there. So I've given up on
Mhm.
trying to guess who's going to want to join or who's going to think it's worth their money, and instead just
Yeah.
focus on trying to take care of the people that are in the practice and not let it bother me when
Mhm.
people don't join or that decide that it's not for them.
Which brings us to another point is another big thing around attrition is how do we deal with it emotionally, psychologically, because
Hmm.
it can feel like a rejection. It can feel like a
Right.
breakup in a way, right? Especially when you're early and you only have maybe a dozen families and one of them decides to leave. It's like, oh, a
Right.
stab to the heart. Wait, what did I do wrong? Is there something that
Hmm.
I failed to do? And we can get in our heads about it, right? We can start to blame ourselves and think through everything we've ever done and think like, oh no, like was I not good enough? Did I miss something in their communication? Did I this, that, or the other, right? And I
Right.
would say if you find yourself doing that, just take a breath, pause, and say, most of the time, what people do is 100% about them and not about
Yes.
you, right? And just like, just taking a deep breath and saying it's okay.
Hmm.
They're making their choice, and it probably has very little to do with me and what I
Right.
did in this relationship, right? It's probably something to do with money, with making hard choices about finances, with just maybe not seeing the value because they're in a mindset or they're in a headspace where they just can't see the value, whereas you can,
Hmm.
right? And other families can. So as long as that's not happening, as long as you're suddenly not losing 90% of your families for some
Right.
reason, please don't blame yourself, right? When families occasionally choose to leave. You can
Totally.
also use it as an opportunity to ask for feedback. If someone is
Hmm.
leaving, find a professional way to say, thanks for letting me know. I've really enjoyed taking care of your family, if that's the case. And I would love your feedback. Is there something that I could have done better in order to keep you enrolled, right? And it's
Right.
just, if you frame it as I'm just trying to learn for the
Hmm.
future, most
Right.
people will be willing to be honest.
Yeah, I think that it's a little bit tricky over text message sometimes to get that across if it's coming from the doctor, because you've had this
Mhm.
ongoing text stream of the things when they've been sick, and then to be like, yeah, we just don't need you anymore, or that sort of thing. So
Yeah.
what we'll often do is say, hey, this is Kelsey, like our office administrator or something, reaching out, just wanted to check in, which just kind of sets the tone that like this isn't actually like your doctor that's checking
Yeah.
in. I think sometimes people
Uh-huh.
feel more comfortable just kind of like talking to the assistant or something like that rather than having to
Hmm.
be confrontational, perhaps. That can be just kind of a helpful strategy
Hmm.
for making sure that you don't make them feel put on the spot per se if you're worried about
Hmm.
that.
Yeah. So since you do that, Phil, have you had any surprising things come up from having your office manager ask parents those questions?
Not really. I mean, it's usually they explain it when they leave. So I haven't had anyone that really like stood out that like we really didn't like this or we
Uh-huh.
didn't like this about your
Yeah.
practice in DPC. One time during COVID, this was when I was in fee for service. People were not happy that I was talking about COVID and those sorts of things. So they left then because they didn't think COVID was
Yeah.
real. I mean, this was very early in the pandemic.
Right.
Um,
Sure.
and so there were things like that, but none since I've been in DPC that I'm like, oh, well, we should adjust our approach or
Hmm.
policies or anything like that because most people say, hey, unfortunately, our finances just aren't working out right, or we had this big health issue and we need to scale back. And that brings up one more thing too that I think about. We've had several families over the years that one of the parents has had a serious health issue, cancer, those sorts of things, and they say we
Hmm.
just really can't afford it right now to keep going with the membership because of all those other things. And the vast majority of the time, what we'll do is we'll just say, we don't want to lose you. We know that this is really stressful. Let's just pause membership for 6 months, keep seeing us gratis, and then we'll resume it in 6 months, or we'll check in and see where we're at in 6 months or something along those lines.
Hmm.
At the end of the day, they're not none of them are such high utilizers that like we're losing a bunch of money in caring for their one or two children over
Hmm.
that period of time, but it certainly helps them in a difficult moment, and I think it just breeds good trust and the focus on the relationship, and it's come up just a
Yeah.
handful of times over 4 years, and I think it has been really meaningful for those families to not lose that in a very difficult moment.
Hmm. Yeah, absolutely. Yeah, I'm trying to think of if there have been other reasons. Oh, one other thing I can think of for some attrition is that I'm a pushover and well, not necessarily that I'm a pushover, but that families will sometimes utilize me just for the period of time that they needed me. And before
Sure.
I established a minimum duration for my contract, this was happening not frequently on an absolute scale, but relatively more frequently,
Yeah.
that families would come with their newborn and then pay for just a couple months of care when they really, really needed that
Right.
early newborn care and the high touch newborn care with all the questions. And then they would leave. I didn't, that left me with an icky feeling because I could
Yeah.
kind of tell that there were some families, not a lot, but some who would kind of just say, "Oh, I was only charging 125 a month for newborns at the time." And so, "Oh yeah, I can get like 3 visits a month for 125." Like they were
Totally.
doing that calculation in their head,
The math
and I
immediately
should
makes
have
sense.
known better. And it took me
Yeah,
some learning to realize, oh, there are some families that will treat you that
that
way.
will do that.
Right. And so I think some attrition was that they never intended to stay. They
Mhm.
used you for what they needed and then they left. Right. And I
Yeah.
think that's where meet and greets and things like that come in handy because if you want to filter those sorts of families, you can get a sense from something like a meet and greet if you're afraid of that happening too much.
Well, I also think that that speaks to charging an appropriate amount. Like in family practice or in adult medicine, oftentimes they'll charge less knowing that these patients aren't really gonna go anywhere else. They're gonna stick around, and so it's gonna even out over time. Whereas in pediatrics, especially if it's something like that, like charging the appropriate fee that if they see you for 3 months and then cancel, that you're not, like, behind because of that. You have
Mhm.
charged an appropriate enough fee that, okay, it would have been nice if they had stayed for 2 years because,
Sure.
the relationship and the revenue and all the different things that are generated through that, but they stayed for 3 months, I got paid, they got what they needed. Maybe they'll send a friend my way, but there's no love lost between us. Whereas if you're putting in a ton of work, and especially in adult patients where they're a lot more complex and it takes a lot of time to get to know them
Yeah.
and all the different things and get all their meds straight and whatnot,
Mhm.
that it can be a little bit of a different calculus. But I think that if we price ourselves appropriately, then it will reduce the resentment if they do stay for a short period of time and then move on. But I think that giving an annual discount is a great way to kind of be like, hey, it's this much per month. But if you want a discount, maybe do an annual membership, and then that also will reduce attrition, certainly.
Mhm. Absolutely. All right. So, lastly, before we finish this conversation, what about numbers? Some of you might be
Mm,
wondering, okay, what's the percent of attrition that I can expect? I mean, is there a magic number? No. But I would say, in my experience, somewhere between 5 or 10% attrition per year is what
Yeah.
I've experienced. What about you, Phil?
I think that's a really fair number. I know that like in adult DPC that they often talk about like 15 to 20%. I think it's less in pediatrics in general. So I would say 5 to 10% makes sense of
Hmm.
attrition per year where people are cycling and cycling out. And I think that is where I would land too.
Yeah. And I would imagine part of that is part of why we are lower than maybe family medicine is because our prices are higher. So that entry point is higher.
Mhm.
That alone is
Yep.
filtering people who truly value what we offer and are willing to pay that higher price for it.
Right. People aren't accidentally signing up. Like they're doing the math and being like, okay, I can
Yeah.
afford this for right now.
Exactly. Yeah. All right. Well, that's what we have to say about attrition. Lots of different reasons, mostly financial. It's not about you, it's probably about them, and about 5 to 10% per year. We hope you found this helpful, and until next time.